A lot of the treatment of asthma in the UK now, in fact, certainly where I work in Scotland, the bulk of asthma treatment is delivered by practice nurses who have become extremely skilled and extremely expert in the management of asthma. And I think they can confidently follow the BTS sign asthma guidelines and step patients up. And it's very rare now that we see any problems with the way that asthma is managed in primary care for those step 2, step 3 patients. And so I think asthma nurses can feel very confident also in stepping patients down. The key points about step down are firstly to think about it. So remember that for patients who are well controlled, it's okay to think about stepping them down. And then to try and think about how the best way to do that is. And that's often a careful discussion with the patient, because patients who've had poor asthma control in the past are often quite keen to stay on their current treatment, because that's the treatment that's gotten them to the point where they feel well.
So the British Thoracic Society guideline says that we should step patients down on a 3 to 6 monthly basis, reducing the dose of the inhaled steroid at 25 to 50% at a time. So when we're thinking about reducing the dose of the inhaled steroid, it's important to remember that the inhaler should be prescribed by brand. This is to ensure that the patient does not receive a different device if there's a generic alternative of the inhaler available, and also to make sure that we have a plan as to when we're going to review the patient. So generally I would review patients between 4 and 8 weeks after a step down of inhaler, as long as they've got an action plan and they know what to do if control isn't achieved.
The way that I tend to step people down is to try and keep them on the same medicine that they've been on before. So that's because I don't want to change too many things at the same time. So I look to, let's say they're on 2 puffs twice a day, I would look to change them down to a lower strength inhaled steroid LABA combination that's still 2 puffs twice a day, so that they don't forget. And if you drop them down to 1 puff, sometimes patients will forget and go back to doing what they were doing before.
So if we're thinking about switching inhalers from one inhaler to another, or stepping down, I would suggest making the switch first, ensuring that the patient remains well controlled, and then possibly after 6 to 8 weeks making the step down from the inhaler strength, while making sure that the patient is confident about what to do if control is not maintained. So the MGP algorithm, I think, will really help doctors and nurses to be more confident about the stepping down of asthma treatment. In my experience, many of my colleagues don't have the confidence to do that, and therefore may perhaps not step people down when they may be suitable for that to happen. And because the algorithm takes us very clearly, step by step, not just which inhaler to use and how to step the medication down, but a very clear guideline about when to do it, and more importantly, when not to step patients down, I hope that the guideline will encourage more of healthcare professionals to reduce the dose of inhaled steroid, to make sure that our asthma patients are not receiving more inhaled steroid than they really need.
And so the algorithm that we've developed for step down won't suit every patient, but for the majority of patients, it's a very, very simple, easy way to step people down through the doses of inhaled steroids, and gives advice on the kind of follow-up and the kind of things that you need to think about.
We need to remember that we have support and guidelines that we can use to help us, and there are algorithms, including the MGP algorithm, which can really help us with that. And I really think that we need to maintain the focus on keeping as many of our respiratory, our asthma patients controlled on the lowest dose of inhaled steroid possible.